I'm Dr. Jim Coyle, and this tutorial is going to talk about the occurrence and interventions related to child maltreatment. Child maltreatment is generally defined as either physical, sexual, or emotional abuse or neglect. I'd like you to watch this video, which does a good job of kind of summarizing child abuse and neglect and what's involved in it. As you're watching the video, consider your reactions. What's the difference between abuse and neglect? The difference between commission and omission? And what do you think about the suggested strategies? The link for this video is included in the comments section. It's also important to recognize, how do you determine what is maltreatment as opposed to what's normal family functioning or family tensions, or how do you determine what's maltreatment and what isn't? For example, what about these situations? Opting out of vaccinations. I initially wrote this before COVID, but with the COVID immunizations right now, it's particularly topical. How about smoking marijuana after the kids are asleep? Leaving an 11-year-old in front of the TV for hours while the parent is working? Or how about a child witnessing his or her parents fighting? You may want to think about, is there a differentiating line between what's normal family tension that can happen versus what's maltreatment? Consider the fact that these are not true-false questions, that most of the time the answers to situations like this are based on context. And many times the answer is, it depends. Take a moment to jot down some ideas about what you think you need to do in order to assess family situations to determine whether maltreatment is going on or not. Another way to think about child abuse and neglect are related to adverse childhood experiences. The assigned article that talks about the study of adverse childhood experiences by Anda and colleagues suggested a number of factors that are associated with this, as well as the impact that it has on children. I'm recommending another video about adverse childhood experiences that can give you an idea of how they occur and what happens to children and what we can do about them. As you're watching the video, and the link is in the comments again, note the reaction that you have to the strategies suggested in the video. It's also helpful to recognize that the strategies in the video use ecological and resilience perspectives. And so it's a way that you can note how those particular theoretical perspectives can show up in suggestions for assessment and treatment for childhood issues. We certainly know that adverse childhood experiences have lifelong consequences for children, and the more adverse experiences children experience, the more consequences they tend to experience. It can lead to social, emotional, and cognitive impairments. It can increase the incidence of health risk behaviors, make them at greater risk for disease, injury, and disability, and ultimately early death. There are a number of theoretical explanations related to child abuse and neglect. The assigned articles, Belsky suggested a developmental ecological perspective that noted the multiple levels of influencing factors. Warmington and colleagues suggested a person-centered approach in which the specific type of abuse patterns or neglect patterns were looked at in order to assess what the best treatment would be. Attachment theory is often used when looking at child maltreatment situations because of its focus on the relationship between parents and children. When you think about intervention for child maltreatment, it's important for you to ask yourself, do you see this as the domain of children's aid societies? Or do you see that social workers and other agencies have a particular role in order to be involved in this? part of the answer to this can be looking at the fact that child maltreatment intervention is very broad. It uses primary intervention, which tends to be universal education about how to properly care for children. Secondary intervention, which is about risk prevention. And tertiary intervention, which is about responding to particular child abuse and neglect situations. Ask yourself what your experiences have been with your clients and what kinds of help you have given to families in order to either deal with child maltreatment, child abuse and neglect, or to prevent it. And jot down some notes about this. There are a number of strategies that can be helpful for social workers to use when they're working with families with children. First of all, home visiting for young mothers can be a real helpful thing in terms of helping them learn how to properly care for children. Parent training classes are a very helpful way of, teaching parents how to take care of their children and how to deal with issues and problems with their children. Preventing intimate partner violence, which we'll talk about in the next tutorial, is also important. Making sure that families have access to social support for the parents, as well as high quality childcare, is also important. Sufficient income so the parents can take care of their children appropriately is essential. All of this kind of leads up to a small group exercise that we'll have in class, in which the small groups choose one of two scenarios. The first scenario is regarding recent immigrant parents of two preschool kids where the husband's lost their job, the landlord's threatening to evict them, and they're really concerned about how they're going to afford to take care of their kids and their family. In the second scenario, the school reports that mother's neglectful because the teenage daughter is truant and misbehaves, and mother's not there to supervise her, with mother saying that she can't control her daughter, who often runs away. I'm going to ask the small groups to consider, okay, what kinds of risk factors, what kinds of protective factors are you going to be looking for in these particular scenarios? What will help you use those the risk and protective factors? How will that help you to develop possible interventions that you could use, particularly in your role in your workplace? So what will that do? I always end by asking you to consider what you've read, watched from the videos, thought about in terms of as I was speaking here, and how we can talk about that in class and all learn together about this. I encourage you to ask any questions that you may have about this so that we can look at this topic and see how you can begin to take a look at it from your own practice standpoint.